Did you know one of the most important numbers you can track during and after head and neck cancer treatment is something you can measure right at home? I'm talking about your mouth opening, and here's why that matters. Many patients don't realize they're losing jaw mobility until they suddenly can't fit a toothbrush into their mouth or bite into something such as a sandwich. They may also have difficulty at their dental appointments with mouth opening, but by then they've already lost valuable motion. Today I'm going to show you exactly how to measure your mouth opening and why tracking it can make such a difference. Why should you measure it? Well, one of the long-term side effects of surgery and radiation can be trismus, or limited mouth opening. As rehabilitation professionals, we often define trismus as an opening less than 35 millimeters. But what's even more important than a single number is watching for changes over time. If your normal opening is 48 millimeters and now it goes to 42, that's information. If it drops again over the next 6 months, that's also more information. Monitoring this helps your rehabilitation team identify changes early and intervene before they become severe. There are different ways to measure. Let's start with the measure of how to if you have teeth. If you have upper and lower front teeth, open your mouth as widely as you can and as comfortably as you can. Place a sewing tape measure that will measure in millimeters at the bottom edge of your upper front tooth. Measure straight down to the top edge of your lower front tooth. Record that number in millimeters. It's quick, simple, and repeatable. I also encourage my patients to write down these measurements so that we can compare them over time. Now, what if we're missing teeth? Many of our patients have had dental extractions or don't have all of their teeth. The good news, you can still measure accurately. If you don't have upper teeth, measure from the bottom center of the upper gum to the top of the lower front tooth. Then subtract 10 millimeters. If you don't have lower teeth, measure from the bottom of the upper front tooth to the top of the center lower gum. Now subtract 8 millimeters. And if you don't have upper or lower teeth, measure from the bottom of the upper gum to the top of the lower gum. Now subtract 18 millimeters. The goal is consistency. So your rehabilitation team can manage and monitor these changes over time. My clinical words of wisdom. One of the biggest mistakes that I see is that patients are waiting until they can't open their mouth before they seek help. Don't wait, measure early, and measure regularly. Track your progress over time. And if you're noticing that your mouth opening is decreasing, reach out to your surgeon or rehabilitation therapist promptly. Early intervention often provides us with more opportunities to preserve function than waiting until significant restrictions have already developed. Here at Head and Neck Rehab, we believe that education empowers recovery. Knowing your body gives you another tool and these numbers for you to be able to advocate for yourself and participate in rehabilitation. I'd love to hear from you in the comments below, but also if you will download HNC Lymph SLP, the app on your phone, you will have at your fingertips tools for you to be able to measure yourself, learn about your body, learn about prevention of changes, jaw exercises, and recovery after head and neck cancer treatment. Be sure to subscribe for our future videos.